Well, I'm Dr. Thomas Kovack at Advantage Orthopedics. I'm the CEO. I've actually been in practice 16 years, and I specialize in shoulder, elbow, and knee surgery. So we see a wide range of patients, from the very young to the very old. We see conditions from rotator cuff injuries to elbow injuries to knee injuries. Also arthritic conditions of the shoulder, elbow, and knee. Patients that need replacements, patients that need tendon repair, patients that have had acute trauma, and patients that have had pain for a long time. Well, I think patient education is key, not only for patients to understand what's going on with them, but also understand the treatment options. I like to lay it out for them, have them ask me questions, and then they kind of pick what option they prefer. I'm always looking for new ways to treat patients to help them recover faster and have less pain. We try to keep on the cutting edge of science and technology here. I think our patients benefit from that, and I enjoy doing it. Some of the newer techniques in cutting-edge technology in the shoulder in regards to rotator cuff repair has been the use of biologics and stem cell, which actually helps patients heal faster and also cuts down the re-injury rate. In regards to the knee, we're doing robotic surgery now, which is very precise, and patients seem to rehab faster and have less pain. I love what I do. I love treating my patients. A lot of them become family. A lot of times they refer their family and their friends, and again, that's the biggest compliment we can get.
If you need shoulder replacement due to an injury or severe arthritis, there's an alternative. The Natural Shoulder is a minimally invasive procedure by Dr. Thomas Kovack at Advantage Orthopedics that restores shoulder mobility and relieves pain. This outpatient, same-day procedure resurfaces your shoulder's ball and socket with minimal bone loss so you can get back to your active lifestyle and exercise without restrictions. Dr. Kovack has helped thousands and can help you too. Call now or learn more at AdvantageOrthodox.com.
In our office, we use platelet-rich plasma, or PRP. We can actually inject that into the area where there's injury or trauma or a tear and help the body heal itself.
The pain was really bad. It got to the point where I couldn't go to work. I couldn't function. I couldn't get off the couch for like probably weeks at a time. I'd sleep sitting up on the couch, sitting on the couch, you know, or on the chair. I mean, it was very rarely would I go to bed in the last probably 6 months before I got this surgery. Went to Dr. Kovack. He took an x-ray of it, and Dr. Kovack said if I wasn't sitting there in front of him and him looking at the x-rays, he would say it was the shoulder of a 90-year-old man, that it was one of the worst he has seen. It was really right after surgery. You know, I mean, I'm thinking I was still under medication or whatever, but I've never had pain not even a pinch. I mean, I got operated on a Friday morning, and the following Thursday I quit taking the pain pills. I only took them that long because everybody's saying you want to stay on top of the pain, don't let the pain get ahead of you. Since I've had this procedure, surgery, I can rake leaves, which I enjoy doing, and I couldn't do that for like 2 or 3 years before the surgery. Playing with my grandkids is a whole different ball game now, so to speak. I can pick them up. I'm not in pain. Well, I'm in the construction trade, and I need, there's a lot of lifting, a lot of overhead work. Before I could just use one hand, maybe fight the left hand up, but now I can put both hands up, you know. I would have done this a long time ago if I knew that's all it's going to take to get my life back. I would have seen Dr. Kovack a long time ago. I heard he was the best, and as far as I'm concerned, he is.
Rotator cuff repair surgery doesn't have to be life-altering. Dr. Thomas Kovack at Advantage Orthopedics has developed groundbreaking, non-invasive techniques to get you back to normal life with less recovery time. The latest advancements in biologic grafts and stem cells help speed up the healing process with less pain and long-lasting results. Same-day outpatient procedures using arthroscopy, where a small camera can look inside the joint with just tiny incisions. If you need shoulder surgery, Dr. Kovack can help at AdvantageOrthodox.com.
So when patients have shoulder arthritis in the ball and socket joint or the glenohumeral joint, there's a lot of different factors. One is their age. I've had patients in their 20s that have severe arthritis. I've had patients in their 90s that have severe arthritis. I think patients feel that we have one surgery that is for everybody, and we really don't. We have a lot of options anymore. For the younger patients or active older patients, I do a shoulder resurfacing, which resurfaces both sides of the joint, and actually patients don't have restrictions afterwards. They can get back to sports, working out, activities as tolerated. If you go to a conventional shoulder replacement, or now they're stemless, where we don't put big stems in the bone, those have a little bit more of a restriction, but they work well also. Those are for if you had somebody with a little bit more bone loss, somebody you couldn't do a resurfacing in, somebody had a little bit more bone defect, we have to make that up with the implant. And then if somebody doesn't have a good rotator cuff, we start looking at reverse shoulder replacement. Now how they differ is when you have a normal shoulder or ball and socket, the rotator cuff holds the ball in the socket so it can move and function. Well, when the rotator cuff is bad, the ball doesn't really stay in the socket. It's somewhat unstable and you don't get the function you normally would get. So we actually reverse the ball and socket, we push out the center of rotation, and it actually uses the other muscles around the shoulder like the deltoid. It does come with some limitations, but with patients that have very little function, it works well. A lot of times, patients that have had multiple surgeries, irreparable rotator cuff tears, it's the only thing really that's going to give them pain relief and function back. So shoulder replacement in general has come a long way. It's really increased function, decreased pain for patients. It's typically done as an outpatient procedure. Patients go home the same day. They usually start therapy within a few weeks, and it really has been successful in getting their pain relief and getting their function back.
I swam in high school and college competitively for many years and been lifting weights since I was probably 18 and been very active athletically. So I think it was just an ongoing chronic issue. I didn't really have any specific injury that incurred, more of an ongoing thing of many years of overuse. Well, I could tell it was getting a little painful on certain range of motion, and I couldn't raise my hand over my shoulder area eventually. And it was clicking and popping and making noises and things. So it wasn't as stable. I couldn't do a push-up. Trying to use the ATM, rolling the window down, and having to get my hand up to being even to my shoulder height, I couldn't do that. So I had to take my other hand and help lift it and put it into the ATM just to slot it. Well, actually, I first searched the internet for options because I did not want a total shoulder replacement. Being relatively young, I wanted to, getting a total shoulder would have given me a limited number of years of use of the shoulder without then having a second surgery. So I searched the internet and actually ran across a friend who knew that Dr. Kovack did this particular procedure that I had run across. I wanted to make sure he was shoulder trained. He did a shoulder fellowship. So shoulders are his specialty. And that was important to me because a lot of guys, orthopedists, do knees, hips, shoulders, elbows, which is great, but I wanted someone who specialized in shoulders as their main area and where they had most of their experience and training in. So that to me was very important. So that was one issue. Secondly, he was very friendly, easy to work with, very nice for answering any questions, took all the time to talk to me. He took an allograft, which is a cadaver cartilage, and put it over the head of the humerus, which is the upper bone of the shoulder or the arm. And then also took some other cartilage, same thing, cadaver, and put that into the cup called the glenoid of the shoulder. So he didn't have to really take any bone out. He didn't have to put any metal in there or any plastic. So it's all live cartilage to replace what I had, which was worn down pretty badly. When it got in there, it was down to pretty much bone to bone. Before I had the surgery, doing push-ups was very painful. I mean, certain other exercises like military press and things I couldn't do. Now I can do both without any problem. I can now do the ATM with no problem. So yeah, I can, before I couldn't raise my arm above here, above 90 degrees. Now it's only up here. I mean, no pain. It works great. It's as good as the other shoulder. Maybe better than the other side. The other side will probably need a replacement eventually too, but no, it's probably actually better than the other side. Again, I've done plenty of therapy on it, so I'm not going to say it just happened by itself, but plenty of stretching, plenty of different exercises through therapy and things, and it's been a great outcome.
I came to see Dr. Kovack back in January. I had shoulder surgery a year and a half prior to that and never had full use of my arm back. I started investigating on the internet and found Dr. Kovack and thought I would come in for a second opinion. It was the best thing I did. I had all these things I couldn't do that I used to be able to do, like canoeing, swimming, gardening, lifting my arm up, mowing the grass, which, believe it or not, I love. And it just ached. So I finally came in, and I had so much confidence in Dr. Kovack. His office is so well run. I saw 3 people prior to talking to him. And when he came in, he just had the confidence and said, I can give you back your mobility. I had the surgery scheduled. I really had no pain after the surgery, started physical therapy, and it just got progressively better. I can do all these things I haven't been able to do in 5 years. So Dr. Kovack, thank you for giving me my life back.
I started having shoulder pains. I couldn't lay on it. I couldn't sleep at night laying on that left side. Then I had problems lifting it. I couldn't lift my arm without assisting my arm to get it up in the air because something was catching. I had a partially torn bicep tendon. I had a partially torn rotator cuff, and I had a partially torn labrum. And on top of all of that, I had bone spurs that are sitting on the rotator cuff, so anytime I would move, it was tearing. When I met with Dr. Kovack, he's very easy to talk to, very personable. He told me exactly what to expect, and everything he laid out is exactly on the timeline at which it was. And they did the rotator cuff repair. They repaired my labrum, they repaired my bicep tendon. He also did a dermal allograft augmentation to assist with the healing process and to make the rotator much stronger. Dr. Kovack was amazing for me. My healing process post-surgery was unbelievable. Because when I started going to physical therapy, they could not believe that I had 0 pain. They asked me several times, who did your surgery, because it's unusual for you not to have any pain, because they had others that had surgery but not the augmentation that I had, and it was quite different. And I haven't had a problem since. I can sleep at night. I don't have the pain. It's been great.
For the younger patients or active older patients, I do a shoulder resurfacing, which resurfaces both sides of the joint. Patients don't have restrictions afterwards. They can get back to sports, activities as tolerated. If you go to a conventional shoulder replacement, or now they're stemless, where we don't put big stems in the bone, those are for if you had somebody with a little bit more bone loss, somebody had a little bit more bone defect, we have to make that up with the implant. If somebody doesn't have a good rotator cuff, we start looking at reverse shoulder replacement. So we actually reverse the ball and socket, we push out the center of rotation. It's the only thing really that's going to give them pain relief and function back.
Yeah, I had a chronic condition called osteoarthritis in my shoulder, and it was caused by an injury that occurred some time ago. So with time, because my shoulder was trying to tell me not to do the extended range of motion, I had extensive bone spurs on the joint. As well as the cartilage had worn away, so it was becoming very painful and also a very limited range of motion. It all came to a head when I tried to paint my house 2 summers ago. And of course I had to do, this kind of thing and using the range of motion and extension. And after the first day of painting my house, it was a disaster at the end of the day. I had pain all over my shoulders, in my neck, to the point where I just couldn't move anymore. So, and for years I was dealing with that pain, but that one event seemed to have really brought it to a point where I had to do something about it. So I educated myself in terms of the procedures that were out there. Of course, there is a total replacement of the shoulder. There also was another strategy or another operation that could be done. It was called total shoulder resurfacing. And when I started looking into that, I found that very few doctors really were involved in doing that kind of operation. And I found that it was done maybe decades ago, fell out of favor, but now there were some newer techniques that were involved in it, and I found that Dr. Kovack was really one of the only orthopedic surgeons in Ohio, if not in the eastern United States, that was skilled at doing this kind of operation. Dr. Kovack then went on to explain that he works with athletes, he works with situations and patients who don't want to have a total shoulder replacement surgery, that want to have full use of their shoulder, but don't want to go through a very invasive type of surgery that total shoulder replacement would involve. And I said, am I a candidate for you? And of course, at that time, I was 59, 60, so I had read in the literature that I was right on that borderline. And so after we talked and we had done the test, my health enabled me to be able to go through and have this different type of surgery. Other than I was so happy to find out that Dr. Kovack, he said, when can I schedule you? So I said I went ahead and got on his schedule probably within less than a month to have this done. Nothing is as good as your natural product. So I had in my glenoid joint, I had a transplant of cartilage. So instead of having a plastic implant in there, I now have cartilage, which is a natural material and is generally going to last much, much longer than any other artificial product that you can have and put into the joint. The head of the humerus then was also, had a lot of spurs and was also the cartilage that is on the tip of the humerus had worn away. So you had bone-on-bone interaction basically in that joint. So replacing the cartilage in the glenoid joint and then taking the tip of the humerus and shaving it down and replacing and putting a cap on it is now the new surface, if you will, and that's where the resurfacing comes. But you're cutting away all of the spurs that had occurred over time, and so now you've got a nice clean connection now in the resurfacing. The resurfacing offers the advantage of being less invasive, and the recuperation time is much accelerated. So you're not looking at 6 months, but really within 60 days, 45 days, I was doing very well. The other remarkable thing about the surgery is that it's outpatient. So I came in to the hospital at about 10 o'clock and was back at my house around 6 p.m. that evening. So sitting on my couch and with the special type of wound dressing that they had on it, I had expectations of being basically out of service for at least 90, if not longer than that. So to have and feel as good as I did, literally within 30 to 45 days after the surgery, to me was remarkable.
During the time that Dave was having the surgery, he was conducting a job search, and we were skeptical about, how long will it take to recover and all that. Well, within 30 days, he was interviewing. He basically just had his arm in a sling. You can adapt almost any kind of regular clothing to be able to get in and out of it. And he landed a position, and it in no way held him back. It's a matter of the surgery. Not only did it help the arm psychologically, it gave him the confidence to go forward and interview it in a very strong way and go forward and not backward. And that's so important to each of us, to feel very, capable and that he can do what he does even better than he did before.
Well, I'm Dr. Thomas Kovack at Advantage Orthopedics. I specialize in shoulder, elbow, and knee surgery. I'm always looking for new ways to treat patients to help them recover faster and have less pain. I think our patients benefit from that, and I enjoy doing it. So shoulder replacement in general has come a long way. It's typically done as an outpatient procedure. Patients go home the same day. They usually start therapy within a few weeks, and it really has been successful in getting their pain relief and getting their function back. So when patients have shoulder arthritis in the ball and socket joint or the glenohumeral joint, there's a lot of different factors. One is their age. I've had patients in their 20s that have severe arthritis. I've had patients in their 90s that have severe arthritis. I think patients feel that we have one surgery that is for everybody, and we really don't. We have a lot of options anymore. For the younger patients or active older patients, I do a shoulder resurfacing, which resurfaces both sides of the joint, and actually patients don't have restrictions afterwards. They can get back to sports, working out, activities as tolerated. If you go to a conventional shoulder replacement, or now they're stemless, where we don't put big stems in the bone, those have a little bit more of a restriction, but they work well also. Those are for if you had somebody with a little bit more bone loss, somebody you couldn't do a resurfacing in, somebody had a little bit more bone defect, we have to make that up with the implant. And then if somebody doesn't have a good rotator cuff, we start looking at reverse shoulder replacement. Now how they differ is when you have a normal shoulder or ball and socket, the rotator cuff holds the ball in the socket so it can move and function. Well, when the rotator cuff is bad, the ball doesn't really stay in the socket. It's somewhat unstable and you don't get the function you normally would get. So we actually reverse the ball and socket, we push out the center of rotation, and it actually uses the other muscles around the shoulder like the deltoid. It does come with some limitations, but with patients that have very little function, it works well. A lot of times, patients that have had multiple surgeries, irreparable rotator cuff tears, it's the only thing really that's going to give them pain relief and function back. So shoulder replacement in general has come a long way. It's really increased function, decreased pain for patients. It's typically done as an outpatient procedure. Patients go home the same day. They usually start therapy within a few weeks, and it really has been successful in getting their pain relief and getting their function back.
Rotator cuff repair surgery doesn't have to be life-altering. Dr. Thomas Kovack at Advantage Orthopedics has developed groundbreaking, non-invasive techniques to get you back to normal life with less recovery time. The latest advancements in biologic grafts and stem cells help speed up the healing process with less pain and long-lasting results. Same-day outpatient procedures using arthroscopy, where a small camera can look inside the joint with just tiny incisions. If you need shoulder surgery, Dr. Kovack can help at AdvantageOrthodox.com.
My life before the surgery was rough. I couldn't put simple things. I couldn't put deodorant on. We couldn't lift my arm up to put deodorant on. I had to just kind of go for it. And I couldn't put a belt on while my pants were on or shorts were on. I couldn't throw a baseball. I'd always have to throw underhand. And all the little kids would always ask me, "How come you throw an underhand?" I can't throw overhand. It affected my work. I couldn't hardly reach overhead, of course, was the big thing. It just made everything I did. Reaching in front of me or to the side was tough. It started gradually for years ago. And I went to 2 different surgeons before I went to Dr. Kovack. And they both told me I needed a total shoulder replacement. And I was too young to have it. Said I can't have it done now, and when I did have it, that was just so I could take care of myself. I wouldn't be able to do all the other things that I did before. Oh, that was hard to hear, that they couldn't help me, because I knew I'd have to live with it for 20 years or however long. I did some research on the internet and I found Dr. Kovack. That was the only site that I came across that Gave anything other than total shoulder replacement. And I made an appointment, got in to see him right away, and he said, sure, we can help you. He told me he could repair it with total shoulder resurfacing. He could take care of it. I believed it because I didn't have anything else to try. It was the only thing I could do. Dr. Kovack performed the surgery as an outpatient, and I was released that same day. I was shocked it was less pain the next day, and I could even straighten my arm out and bend it. I had my shoulder scoped about 10 years ago. 6 months after having the scope, I didn't feel near as good as I did 2 months after having the resurfacing. I have mobility now that I didn't have before, and I have strength now that I didn't have before, and I have no pain. I can go to the gym, I can do push-ups, I can do pull-ups, I can do pull-downs, I can throw a ball now. I can do things now that I couldn't do for 15 years without pain, and it feels great to do it. I'd recommend Dr. Kovack because he had a solution to my problem, and then he followed through with it. He took care of it. He was very professional. His whole staff was professional, and they took care of it, and now I'm way better than I was before.
My name's Al Catanzarit. I am a few months away from turning age 60, and born and raised and continue to live here in beautiful Western Pennsylvania. I first injured my shoulder in my early 20s, weightlifter, boxer, martial artist, trying to do crazy things, and my shoulder started to sublux or partially dislocate. And it did so on a regular basis, and instead of having it taken care of early on, I let it go. And I kept training, kept lifting weights, kept boxing, and it kept getting worse. As my shoulder got progressively worse, I started to notice that everyday things that I could do before started to become a problem. Reaching in the back of my truck to grab my briefcase, my shoulder would almost dislocate. Throwing baseballs to my 3 sons, playing fetch with my dogs. All those activities you take for granted. Actually sleeping. I sleep on my side. Unfortunately, it was on that side. Some of those things, again, that it's like, oh my goodness, I can't do these simple things anymore. For the next 25 or so years, but during the course of that time, it became very arthritic, bone on bone, and that's when I realized that I had to look into some kind of remedy. Once I got to kind of that breaking point, I started to confer with surgeons in my area, and they all came to the conclusion that what I needed was total shoulder replacement. So I started to research other options, and I came across Dr. Kovack's website, and I started to read and research the OVO with inlay glenoid surgery. Once I researched and had my initial consultation with Dr. Kovack, he said I was a candidate for the OVO with inlay glenoid surgery, so we scheduled it. The date of surgery, I had to be there at 5 a.m. It was just as he and his staff had said it would be. What was surprising to me is after the surgery, from the moment I woke up in recovery, I had no pain, none. And I was waiting for the other shoe to drop and the pain to start, but I really had no pain. I started the rehab the following week, and 12 weeks of progressive rehabilitation put me back in the gym as Dr. Kovack said it would. So from surgery to being back in the gym and starting to do the things that I love to do, and at that point in time having full range of motion, was 12 weeks, and I thought that was incredible. After the surgery, after the rehab, I was back to the boxing and all the martial arts, but really, I think struck me even more so was the everyday things that I had issues with doing before the surgery. From grabbing a plate, from throwing a bone to my dog, from playing baseball with my kids, washing my back, those kind of things that, until you have an injury, you take for granted. But then once you have the injury and you feel better, you never take for granted again. I truly want to thank Arthrosurface for developing the OVO with inlay glenoid surgery. It literally changed my life. I don't think it's even too dramatic to say it gave me my life back. I can do the things that I love to do that I couldn't do before. So thank you, Arthrosurface.
So one of the technologies that I really like to use is dermal allograft, which has actually been shown to increase the strength of the repair right away. People feel like they recover faster and also allows them to get back to activities faster.
If you need shoulder replacement due to an injury or severe arthritis, there's an alternative. The natural shoulder is a minimally invasive procedure by Dr. Thomas Kovack at Advantage Orthopedics that restores shoulder mobility and relieves pain. This outpatient, same-day procedure resurfaces your shoulder's ball and socket with minimal bone loss so you can get back to your active lifestyle and exercise without restrictions. Dr. Kovack has helped thousands and can help you too. Call now or learn more at AdvantageOrthodox.com.